Okay, gentlemen, we are live. I'd like to welcome everybody to today's weekly briefing. I'm Mike Paulus, Town Manager, and with me today are Chief Seward and Michael Pascasella, Director of the East Shore Health Department. We unfortunately don't have a representative from our police department in either the Chief Howland or Deputy Chief Lovelace. Unfortunately, they are very busy at the moment. And hoping to have Jim Buck potentially also tied up with other duties. And Jim Buck is our emergency management director. We hope that maybe Jim can join us partway through the briefing. So as always, I'd like to welcome you to the briefing, and our goal is to try to provide you with updated information on what's going on with COVID-19 and the pandemic, and try to provide the resources and information that we have that we're working on, and trying to get that out to you to share with the public and to help with any questions you may have. So we like the broadcast to be interactive, and hope that you'll participate and share the link and share the feed with friends and family, and post your comments or send us your emails. And to that end, we've developed a separate email account called public-comments@townofnorthbrantfordct.com. Again, public-comments@townofnorthbrantfordct.com. We can take your emails there, and also, of course, you can post on Facebook. Would like to know what you're thinking, and of course, if you have any specific questions, we'll be happy to get you an answer to that. But we also you can monitor and look at our police, fire, and EMD Facebook pages as well, and of course, East Shore District website, the state's Department of Health website, and the governor's website are full of information and executive orders that may help you, find answers to questions that you may have. We try to follow the format of giving you an update on the numbers. But again, I like to thank everybody involved who are out there on the front lines for all that you're doing each day, day in and day out. And we're all doing the best we can, which is great, and just gotta keep doing what we're doing. So to that end, I'll jump right into the local numbers, and good news to report today that our numbers are holding steady. So we reported 83 cases. We're still at 83 cases, confirmed cases, since the start of this pandemic. So unfortunately, 6 fatalities, but our numbers are holding steady right now, and I think that it is a reflection of what the community is doing to follow the protocols in terms of social distancing and wearing face masks and staying home if you can, working remotely, and doing all the necessary things to stay healthy, which is great. So that bodes well with a number that's holding steady like that. And so again, do what you have to do to stay safe. And again, hopefully you can find the supplies and masks and handmade. We've been very fortunate to have a lot of donations for our employees and first responders. And again, thank those individuals for their generosity and helping us out. We all doing what we can here at Town Hall. I talked about partial reopening. I talked about last week and the week before about our tax payment, and the extension is still June 30th for that. And there's information on our website. We're doing what we can by appointment, and moving all of our transactions, if you will, that can be done remotely, electronically. We're doing that. And looking to continue the partial reopening with appointments, and working on a plan with the library and rec center, senior center, for partial reopening there. With the senior center, rec center, they have a fitness room that we're working on trying to get that open to the public not next week, but the week after, on the 22nd, or the week of the 22nd. So we're still working out plans. I should have those to be detailed next week. And also the library has set up and is already implemented the no contact curbside pickup, which I think, what I hear, is running very well. And it's another way to service patrons of the library. And of course, that's important for a lot of people. And we enjoy, servicing the community and providing great reading material and resources and we'll continue to do that as they work in a plan as well for the 22nd and beyond to see what they can do to safely allow patrons back in. So stay tuned for that. We'll have more detail. And now at this point, I think I'll pause and defer to Chief Seward and any update that you may have, Chief, and tell us about.
Sure, Mike. Thank you very much for having us here today. And just to echo your thoughts, I think the community has done an outstanding job in staying home and staying safe, and whenever necessary, wearing their masks. We in the fire department have continued to see a slow rise in the number of calls for service that we have received, kind of going back to what the norm was prior to the 13th of March. Our personnel have done an outstanding job of actually remaining safe and healthy during this entire COVID-19 public health emergency. And they'll continue to respond to calls and take the necessary precautions based upon the symptoms of those people that become sick or injured in town. So we're not going to drop our guard. The guard will still be ever present. And finally, during this whole event, we recognize the fact that many residents in town have foregone celebrations. And they've invited members of the fire department specifically to participate in drive-by celebrations. So the numbers are very large with the number of events that our members have participated in. And I really have to take this moment to thank all the members for all their time in which they've donated to the department to take the apparatus and make people happy in town, because that's what it's all about. And this week, the celebration of the promotion of the 8th grade class, and then yesterday, the graduation for the high school, where our Tower 1 proudly displayed the U.S. colors at the walkway between both schools, and the ceremony was outstanding. So with that said, I remind everybody to stay healthy and protect yourself at all times. And if there's a question in your mind, if you need to wear a mask, wear a mask. It's pretty simple and it's common sense. So I appreciate the ability to convey the messages today, and stay healthy, you too.
Thanks, Chief. That's great. I'd love to hear that about the community, helping out, helping one another, because it's not just the physical, the space and keeping healthy, of course, is first and foremost on our mind. But the physical health is one thing. The mental health component is another. And I think maybe we'll have some information I'll try to put together for next week as well. But thank you for that. No, that's great to hear, and I appreciate it. That knowing that you guys are doing the best you can, which is great. And Mike, I know you're probably busier than any of us for sure. And we're happy to have Mike on the call today for this briefing. And you not only represent our community, but 2 other communities. I think it's very helpful for us, at least from my perspective as an administrator, and what we have to do to disseminate information among many departments to know and get a sense that you're working with other communities directly, which gives us insight. And, people ask a lot of questions about trying to forecast, and that's got to be the most difficult thing to do. But I know you're here to talk a little bit about and give us an update on the partial reopenings and obviously various different business components, but also town and school components, and that's a lot on your plate. And I thank you for taking the time to join us today. And what can you tell us, Mike?
All right. Well, thank you, Mike. Thank you, Bill. Again, my name is Michael Pascasilla, and I'm the Director of Public Health for the town of North Branford. And as Mike said, I represent other communities. And I think I'll start there, is that not only locally in the town of North Branford did we work together, but we worked with our adjacent communities. We shared information. We have agreements with our other communities to work together, and we're all in this together, and we're making decisions that are consistent across the board. I'll start with just the numbers, and in a sense, just to reflect what Mike was saying, that here in North Branford, while we've had a number of cases and some fatalities, compared to other communities, we're faring better. Right now, the numbers are stable. Not just here in North Branford, but across Connecticut, they seem pretty stable. And if you've been following what the governor is saying, we're in the process of looking at the different metrics. And in Connecticut, we're in a much better place than other states. But I do need to bring that up, that as we look around the country, we're seeing significant spikes in some states. In fact, we're seeing some of the highest levels in other states that are higher than when the pandemic first started. And that's concerning, and we just need to be mindful of that. And as you know, the governor and locally we're following the data. The public health data is going to drive our decisions. But at this moment in time, we're enjoying a nice stability within the pandemic. The other thing I want to mention is locally, we are working with the State Department of Public Health on testing, and our testing capacity has increased, not just across the state, but locally. And we're doing something called contact tracing. And you hear the governor talk a lot about contact tracing. We're doing it here locally at the health district. We hired staff, we have volunteers, we're using the state database. And so we're moving forward with that, because that's one of the metrics that needs to happen as we go through the different phases. I'm going to talk about the different phases in a minute, but I do want to just say a couple things about graduation. We've gotten some calls from some parents and some from other community members about their disappointment in graduation. And, I want to acknowledge that. As a father of two young boys, one in high school, my niece didn't get to have a traditional graduation. And so on the human side, on the personal side, I certainly understand. But what I would like everyone to know is that Superintendent Shoemaker, Board of Education, medical advisor, Dr. Nolfo, and I, we met, we went over, we looked at the data, and a lot of hard decisions went into graduation, and we tried to make it as best we could. And I think it really went well, given the fact that we're in the middle of a pandemic. It was a hard decision, and we worked together as a community to make it special and to protect all members of our community. And it's also consistent with our adjacent communities and how they're proceeding with graduation. So the different phases of the pandemic. Right now, we're in phase 1. We are entering phase 2. And so in phase 2, some different sectors are going to open up. For instance, we're going to have some level of dining inside at 50% of our restaurants. Some other businesses are going to open on June 17th. We've been putting out and working with the state on clarifying some of the guidance locally. And then the next phase after that would be phase 3, which is later in June. As the governor has said, we're going to follow the data. The data will decide what those dates would be. But right now we are scheduled for June 17th for phase 2, and then phase 3 later in July. And then lastly, just to reinforce, we are doing well here in North Branford. And the reason why we're doing that is because our community is listening. Our community is working together. We really need to hold the line on that. So please continue with the social distancing, wear your face coverings. And if you do have any gatherings, you really want to make sure that you adhere by these guidelines. They're really, really important. We're in a good place. Let's stay there together. So with that, Mike, that's all I have. And if we have any questions, let's answer them.
That's great. Thank you, Mike. No, just to clarify, I think there was on the phase 3, you said July, correct, for phase 3? or end of June?
Phase 3 is in July.
In July. Okay.
Yeah, in July. Yeah, right now it's scheduled for July 20th.
And what are some of the components or businesses, or who's in that category of phase 3? If you could give us sort of an idea.
It's still being decided. I think from what I understand, phase 2, most of the businesses are going to open, and there's going to be some level of restrictions. For instance, restaurants and some other businesses are at 50%. In phase 3, they're looking to up those numbers a little bit higher than 50%. Phase 3, we're also looking at some loosening the restrictions on some other types of businesses. Some of the businesses are slated for 25%, some are 50%. So in general, we're looking to lift some of those restrictions a bit. But again, we have to wait, and what the governor wants to do is just, hold tight for a bit, see how things go, and that will drive the decisions. Next week, the conversations start for phase 3. So when I get some more information, I'll share it on either the next call or the following call.
Right, and I'm sure you take a lot of calls like we do here. We try to, whenever we can, answer those questions. Is there a site that you recommend? I've been pushing the governor's site in terms of his executive orders, where you can find most of the detailed information. Public health site. Is there any other resource that we may be overlooking that the public we should share with the public?
Mm-hmm. I think the two best sites to go would be the State Department of Public Health, where they list the different sector rules, and all the documents are listed. Also with the latest state government data, and also some local data. The other site to go to would be the Centers for Disease Control. They have a lot of good information. And so what the state of Connecticut is doing, like other states, is they look at the CDC guidelines and they tailor fit them to our state. So you have the federal guidelines, which sort of broad brushing across the country, but then a little more specific here in Connecticut. And so the guidelines you really want to follow are the state guidelines, but they do model the federal guidelines. And when it comes to wearing face coverings and social distancing, they're in sync. There is no difference.
Okay, and I don't think we covered testing, but is there anything you want to say about testing? In terms of the test for the virus or the antibodies. Anything you want to mention on the expansion of that?
Yes. So as we have more and more capability to do testing, first the conversation should really happen with your physician. If you want to be tested, you should start with your physician. There are also some other tests that you can get that you don't need a physician's note, but anyone who's going to be getting tested may have some concerns about their health. And if there's anything going on, you just want to have that conversation with your physician. As far as the serology test goes, that is basically to see if you've been exposed. So you're not sick, but you want to know, well, maybe, 2 months ago or last month, I didn't feel well. And so maybe I was exposed. And so that's a blood test. That is something that you do want to talk to your doctor about. Again, there are some sites that will do it without your physician's permission. But I really recommend, we're talking about health. And anytime you have questions about your health, that conversation really needs to start with your physician.
Absolutely. Yeah. Great advice, Mike. Thank you. And we'll move on, I guess. I don't see any messages at this point. I'm checking also for our emails. Give me 1 second to roll into that and just check the email box. And I don't see any there, but I know a question that came up last week about our sunflowers, and they're out there. So it's prime time to plant right now. So if you can get those seeds out, I think we have sources located at the libraries and other locations. So you can always email or call in, and we can direct you to the right source to pick up some packets for both the dwarf and tall sunflowers. And maybe that's part of so that the mental health is gardening and getting out there, some fresh air to help get our minds off of COVID and staying inside.
Yeah, Mike, I just got to chime in here for a second, because my family and I planted some sunflowers this year. And one of the things that really drove us to do it, driving down, Route 22 and seeing all those sunflowers. They're amazing. They make us happy. So we planted some this year, and I might have to get some extra seeds now.
Sure, we have them. We've got them. We're getting them out there. So I'll put some aside for you. And thanks for mentioning that. I think we'll wrap up with again, don't forget for food scarcity and those that are less fortunate, that we have the food pantry. I give them a plug just about every weekly briefing, and their number is 203-208-2581. They have donations on Tuesdays from 3 to 6. So if you can help out, that's great. And we're a strong community with a big heart. So people have been generous, and that's great. And I want to thank everybody out there for doing what they can to keep our numbers low, keep our numbers down, which is it's a great news to be able to report today. That we're doing all we can to slow this thing down, and we'll stay on top of it, and we're available for anybody that has any questions or concerns. And we continue to help businesses that are on the list. We keep every day giving out the thermometers, the masks, and other PPE that is coming through the state. So we're just trying to get businesses up and running and doing the best we can. And Mike, we've done a whole show on that, and we'll continue to work with those business owners and help them and assist them. And I thank you for all that you're doing out there. And I think that'll put a wrap on today's weekly briefing. And again, thank you, Mike.
Oh, well, thank you, Mike.
Stay safe. Be well.
Okay. Bye.